For testing cranial nerve 1, you want to use something that has a strong scent so you can identify if the patient has their sense of smell intact. So Sam, what I'll have you do is close your eyes, and then you'll place the scent in front of their nose, and then what do you smell?
Coffee.
Perfect. Cranial nerve 2, we are testing visual acuity to test the optic nerve. You'll be using a Snellen chart, and this exact Snellen chart is on an 8x11 sheet of paper, so you'll want the patient to stand 10 feet away. You'll also want your patient to wear their glasses or contacts if they normally do. From here, you're gonna have the patient cover their right eye and read with their left eye the lowest line on the Snellen chart.
F-E-L-O-P-Z-D.
And then you'll have the patient cover their left eye and read with their right eye.
F-E-L-O-P-Z-D.
Then they'll take all hands away and read the lowest line they can with both eyes.
F-E-L-O-P-Z-D.
Perfect. And you're just looking here for any differences in either eye. For cranial nerve 2 and 3, you'll be testing the pupillary light reflex. So to do this, you'll need a light. And we'll have Sam take off her glasses for this. You're going to be looking at both the eye that you're shining the light into and the eye that you're not shining the light into, and both should constrict. So I'll have you look right at my nose. You'll raise the light up, and you're just looking to make sure that each pupil is constricting, and then as you take the light away, the pupil should dilate. You usually do 2 tests on each side. For cranial nerves 3, 4, and 6, we're testing the motor component of the eye, so we'll use the H test. So for this one, Sam, I'm gonna have you follow my finger. You wanna make sure to get all 4 corners, move slow and controlled, and we're watching for ability to track in all planes, and also looking for any drooping of the eyelid or inconsistency in tracking. For cranial nerve 5, or the trigeminal nerve, we'll be testing a sensory component and a motor component. For the sensory component, you'll use 2 cotton swabs, and you will go along the forehead and ask the patient if it feels the same or different.
Same.
You'll go near the cheek, same or different.
Same.
And down near the jaw.
Same.
Make sure that the patient's eyes are closed during this test as well. For the motor component, you'll ask the patient to clench their jaw, and then you will feel the muscles of mastication, so masseter here, make sure they're similar side to side, and then up near temporalis. For cranial nerve 7, or the facial nerve, we'll be looking at the patient's facial expressions and observing for asymmetry side to side. So Sam, I'll have you smile big for me, go ahead and frown, raise your eyebrows, puff your cheeks out, perfect, and close your eyes nice and tight. For cranial nerve 8, you'll be testing the patient's hearing from side to side. So Sam, I'm gonna have you close your eyes. And what we'll do is you're going to move your fingers back and forth, starting out here and moving it closer, and the patient will tell you when they start to hear it.
I can hear it.
Perfect. So this is the distance. We'll go from the right side, same thing.
I can hear it.
So there's a difference here side to side. For testing cranial nerves 9 and 10, you will test them together. We'll be assessing the gag reflex, ability to swallow, and the rise of the soft palate. So Sam, I'm going to have you open your mouth and say ah for me.
Ah.
Perfect. So we're looking for the rise of the soft palate and the uvula rising. Next, we're going to be looking at her ability to swallow. So you can either have them just swallow their spit, or you can have them swallow a glass of water. Perfect. And then lastly, you can do the gag reflex, where you take a tongue depressor and place it on the back of the tongue to elicit the gag reflex. For cranial nerve 11, you're testing the motor component of the upper traps. So you'll just have the patient shrug and hold, and you'll try to resist down and see if there's any differences in strength or ability to hold that side to side. To test cranial nerve 12, you'll ask the patient to stick their tongue out and see if there's any atrophy or deviation side to side. If the tongue does deviate to one side, it's deviating to the weak side or the side of impairment. So Sam, I'll have you stick out your tongue.